Fabry disease is due to deficiency of an enzyme, alpha-galactosidase A, and we had the idea of, well, let's just replace that enzyme. And it turns out that if you modify the enzyme a little bit to promote uptake into the cells, and then you give enzyme infusions, it is taken up by the cells, and that helps to clear the stored material, which then protects the body from further damage. It is not 100% effective at this point, but it does work. Now, Fabry disease is a disease that changes slowly over years and even over decades at times. So one of the challenges is, what do we measure to make sure that our treatment is hitting the target? With enzyme infusions, the things that we can measure in the short term include some biomarkers. So GL3 or GB3, those are the same thing, but people use both terms. And lyso-GB3, which is a more specific biomarker, tend to decrease fairly quickly after initiation of therapy. And they do not correlate with how the patient is doing at that time, but they do potentially correlate with how the patient is expected to progress, so can give you some idea of where that patient would be in 5 to 10 years if they maintain that level of those biomarkers. We can also look at organ-specific biomarkers like cystatin C or creatinine for the kidneys, troponin or proBNP for the heart, and try to normalize those. Now, we do not use the enzyme activity level as a biomarker for the enzyme infusions, because we know that that's going to go up and down independent of the success of treatment because we're infusing it. Now, the second option that is currently available for clinical use is a chaperone that also results in changes of the biomarkers. So, for example, GB3 and lyso-GB3 will decrease, but they don't decrease at the same rate or in the same pattern that they do for the enzyme infusions. But they do get eventually down to about the same level. So you can use them in a similar way. And with the chaperone therapy, measuring the enzyme level in the body, so in the plasma or in the white blood cells, can give you an idea of is the therapy that you're delivering resulting in a biologic change. If it is, you should see the enzyme level going up in a measurable way, preferably into a range that you would expect to be associated with non-progression of the disease if the patient were not on treatment.